Hi guys, this is Dr. Nida with Keys of Health. Heartbreak and horror are the only words that come to mind when we see the COVID situation in India. The healthcare system has pretty much collapsed. Patients are being turned away from hospitals due to lack of bed space. New York City was in a similar position last year at the beginning of COVID. People were left at home by ambulance crew because of lack of beds and lack of ventilators in hospitals. Some of my own acquaintances were among those people. But I tell you what, many of them survived and recovered. I will share in this video some very simple and highly effective treatments. Thousands of people have benefited from it. They have overcome COVID using these treatments at home. Hundreds of people I personally know have recovered from COVID using what I'm about to share with you. This is a very common practice in many parts of the world, including African countries and the Caribbean. I'm not saying that this is a replacement for the treatment that you will receive in the hospital, not at all. I'm talking about what you can do to control your condition to avoid ending up in the hospital. It is very rare that a person contracts the virus today and tomorrow they need oxygen or a ventilator. There is precious time that passes between that period. When the healthcare system is in the condition it is in, we need to do everything in our power to take charge of our health and avoid exacerbating the situation, the condition. If you do get short of breath, you need to seek medical care. In this video, I will hand you some very powerful keys of health. I shared them in a video last year and hundreds of thousands of people have benefited from it. And many among my acquaintances have recovered from COVID following these. The first thing, and probably the most difficult thing at a time like this, is not to panic. Don't panic. Panic is not going to do anything. In fact, it will make you more susceptible to contracting the virus by compromising your immune system because you're making yourself anxious. Instead of panic, be very, very cautious. I will break down this video into 3 parts. You don't have to do everything, but do as many of these as possible. Our goal is to keep the lungs clean, the breathing passage clear, and give the body the ability to fight this virus. Trust me, it works, and it will work for you, God willing. The first thing we need to talk about is personal care, hygiene, and cleanliness of the environment. I know not everyone has the luxury of isolating a COVID patient in a separate room with a separate bathroom, but we need to be careful. You need to disinfect the environment whether you have a COVID patient at home or not. If the virus is going around strong, this is the least we can do to protect ourselves. And India is full of natural treasures and blessings. One of the cheapest disinfectants you can use is neem leaves. Just burn some neem leaves in the house daily. That's all you have to do. I know it is a common practice, or it was a few generations ago. Bring it back. It is very effective. You can put a few stalks of neem leaves around the bed of the patient or under their pillow as well. Bay leaves and cloves are also amazing. Burn them in the house once or twice a day. You don't have to choke the place with smoke, just enough to let it spread around the room. Luban is another great herb to burn. Now, there are 2 kinds of Luban. One is what is more commonly used in India, and it's called gum benzoin. That's very good to burn around the house. Make sure you have the windows open and a proper ventilation when you burn these herbs. You don't have to do all of these herbs. Whatever is available and is cheaper to access. 2 to 3 times a day is enough. Going back to Luban, the other Luban is frankincense. It's more expensive, but it is very good for the lungs. And I will talk about it in a few minutes in a bit more detail. Both Luban look the same, but they are resins from different trees, so their properties are different. Now going back to hygiene, make sure you clean the house properly, especially the bathroom. Use a disinfectant spray to clean the area after it has been used by a COVID patient. Make sure you wear a mask around them inside the house. Wash your hands as often as possible and let the patient wash themselves as often as possible and as well as possible. Change the clothes regularly. Don't let people sit in their own sweat for too long. Change the clothes as often as possible. Let them sit in the sun at least 30 minutes a day. If the sun is too strong, cover their head, put on a hat to avoid heat stroke, but let them have daily exposure to sun, ideally between 9 and 11 a.m. Take care when washing the clothes, dishes, towels, and bed sheets of COVID patients. Just to be safe, wash them separately. Now, this is about the hygiene and environment. Even if the patient is feeling hot, don't have the fan directly blowing at them and avoid using air conditioner. It is better for them to be warm than to be cold. If you have access to eucalyptus plant, have eucalyptus plant in the house. Put a few stalks of leaves in the bathroom. Every time you shower, the volatile oils of eucalyptus leaves are released in the air, and they're very soothing for the lungs and help ease breathing. I will add a few breathing videos I have shared in the past on my social media. I will add them to my YouTube channel as well. Please check them out so you can help the COVID infected person at home with their breathing. As soon as you feel COVID symptoms, start gargling with salt. It is better if you use pink Himalayan salt or sea salt, but any salt would be fine. I have done a whole video on the benefits of it. This is your first line of defense against this upper respiratory virus. You want to gargle with salt in warm water as often as you can. I'm talking about every couple of hours. Even if you don't have COVID, you should still gargle with salt water every night and every time you come from outside. You can't go wrong with that. Please check out my video on the topic, which I will link here. Now let's talk about food and drinks. You have two main goals here. Strengthen the immune system to give the body a fair fighting chance. And second, give the body those foods that are healthy for the lungs and would prevent clotting and inflammation. You see, it's an upper respiratory infection. It attacks the lungs. That's when people gasp for breath. If we try our best to keep the lungs clean and airways clear, we will prevent the escalation of the virus, and the person has a much higher chance of recovering and avoiding hospitalization. We need to go heavy on foods that boost immunity. India is so rich when it comes to its produce. Make use of it. Get seasonal fruits and vegetables. I'm not talking about expensive stuff. Local seasonal stuff. Drink fresh vegetable juices. Include citrus fruits, onion, garlic, ginger, lemon, moringa, amla, karela, which is bitter gourd, beets. They're all great and are so easily available in India. Garlic is an anticoagulant, meaning it prevents blood clots. It has antiviral and anti-inflammatory properties that makes it an ideal food for people of all ages at a time like now. You can't go wrong with garlic. Eat it raw to get the most from it. I know it can be difficult, but I have shared how to use garlic in a separate video, which I will link here so you can check it out later. I will share with you another very effective way of using garlic for lungs in just a few minutes. Avoid foods that can cause mucus. Usually these include dairy and wheat products, so I would suggest to avoid giving these to COVID patients. Instead, go heavy with low-calorie foods that are warm and healthy. Things like soups, juices, chicken, eggs, fish, and alternative grains like ragi, amaranth, and oats instead of wheat. Spices are amazing, and you are the land of spices. Cloves, cinnamon, star anise, turmeric are all very healthy for lungs and the immune system. You can add these to your foods or even make tea and have a cup or two daily, even if you're not infected with COVID. This will help keep your immunity strong, which is what we all need right now. Herbs like moringa, oregano, thyme, tulsi, which is basil leaves, lemongrass, they're all great for immunity as well as lungs. Get whatever you can find easily and make it a regular part of your diet. The easiest way to use them is as teas, or you can add them to your food. Go ahead and incorporate them any way you can. I'm going to share with you a drink that has helped thousands of people worldwide. It is a simple cloves-infused drink. All you have to do is get 2 liters of water and soak 15 to 20 cloves in it for 24 hours. After that, take small sips from it every now and then. I'm talking about every few minutes, 30 minutes or so. Give this to the COVID patients. It will help keep down the inflammation of the lungs and will help with the breathing. Once you start using this water, prepare the next batch to be ready in the next 24 hours. This is the water you want them to drink. God willing, you will see amazing results. You will see what it will do. Another drink that is very effective is frankincense water. That's the other kind of luban I had mentioned earlier. You want to get good quality food grade frankincense, not the one that is used as incense. Soak about 10 grams of frankincense resin in about 1 liter of water. Let it soak for about 24 hours and then drink from it. Just like the clove water I mentioned, it has anti-inflammatory properties along with many other benefits. It also helps expel mucus from the lungs. It is specially recommended for people who are asthmatic, so you should be having it regularly if you're asthmatic, and especially when the virus is going strong. Other than that, you want to focus on warm drinks only. Absolutely nothing out of the refrigerator or with ice. And please avoid sugary, syrupy drinks and food and drinks from outside. Eat healthy and eat clean. This is not the time to satisfy our taste buds. Now let's talk about supplements. Last year when the pandemic was raging, I had done a video with a natural treatment plan. This was one of the first plans that anyone had shared, and I'm so grateful that it helped hundreds of thousands of people. Let me repeat again, these are not medicines for COVID. I'm not claiming that at all. These are well-known, well-respected supplements with antimicrobial properties and have well-documented benefits in fighting several viral conditions. We have seen that they helped many COVID patients as well. So instead of sitting around doing nothing when we have the virus, it makes sense to equip the body to help fight it. And this is what it is about. We just want to give body a fair fighting chance. Before I mention the supplements, I want to say that it is a good idea to have these supplements handy, even if you or your family members don't have the virus. You don't want to go around looking for them if and when you catch the virus, God forbid. You can check out my videos on how to use these supplements for preventive purposes. The dosages I'm sharing now are for those who have the infection. The first supplement you want is vitamin C, 1000 mg, twice a day. You can give children liquid vitamin C. Vitamin D3, 5000 IU or 125 mcg twice a day. Zinc, it is better if you can get zinc picolinate, 50 milligram once a day. I usually recommend eating zinc-rich foods instead, but that's what you should be doing now to prepare your body. But if there is an infection, you will need to take supplements, so make sure you do have the supplements. Carob molasses or carob essence, it's great for the lungs. In Urdu and Hindi, it is called harnoob, and in Arabic, it is known as haroob. I hope you can find it. It is wonderful for respiratory health. And again, it's great for people who have asthma, and I would highly recommend for them to be taking it, especially right now. Manuka honey or any wild, raw, and unpasteurized honey. Add 1 teaspoon of Manuka or any raw honey to warm water. Take small sips and let it sit in your mouth for a few seconds before you swallow it. It's almost like you're warming your throat and massaging it with that honey water. The next thing is black seeds or black seed oil. 1 tablespoon of black seed oil is very, very effective. It has antimicrobial properties and it is great immune booster. You can give 1 teaspoon to children over 3 years of age once a day. Last but possibly the most important thing, steam inhalation. You will not believe what it does to your airways and lungs. It can make a difference between going on oxygen or avoiding it. It does wonders. You can get peppermint, spearmint, or eucalyptus essential oils, add them to a pot of boiling water, and take deep breaths. You want to fill your lungs with this. Take deep breaths for 5 minutes, cover the pot, and go lie down. You need to rest. Do it again after 15 to 20 minutes. Keep this pattern for at least 2 hours and then take a break. After 3 to 4 hours, do the steam inhalation process again. You want to keep your airways clean and free of inflammation. You can add a few tablespoons of Himalayan or sea salt to this water or make it even more effective. The next method is a well-known and well-respected remedy which is commonly used in Africa, Caribbean, and Middle East. Many people roll their eyes over it. Let them roll their eyes. Haters gonna hate. You do whatever you can to save your life and to overcome this virus. I promise you, I have seen this work over and over again. I saw a video of a person from Italy. He was denied treatment at a hospital because of high caseload at the time. He had collapsed on his way to the pharmacy and practically dragged himself home. He claims that he was dying. He could barely breathe. He did this exact treatment, and after 24 hours, his breathing had improved tremendously. He never ended up in a hospital and recovered at home. And he's not the only one. Many people have tried it and said the same. I am confident it will help you and your loved ones as well. And the best thing is that all the things you need for it are already available in most homes. Take an onion, a head of garlic, a piece of ginger, smash or roughly chop them and add them to a pot of water. To this pot, add a tablespoon of cloves, a few sticks of cinnamon, a few pieces of star anise, turmeric, fresh or powder, a lemon cut in half, and a couple of tablespoons of Himalayan salt. Bring it to a boil. As it starts coming to a boil, start inhaling deeply into your lungs. If you already have difficulty breathing, this can be painful, but don't give up. Keep doing it for 5 to 10 minutes. You need to push yourself. You may feel exhausted and sweat profusely after that. Go lie down, rest, and do it again after 30 minutes or so. You want to do it 4 to 5 times in 2 hours window. After that, you can take a break for a few hours and then repeat the cycle again. After each cycle, the deep inhalation should become less painful and the breathing would begin to improve. I have done a video explaining the scientific studies backing this treatment. You can check it out at your convenience. I will link it here. I'm not asking you to do this in place of a medical treatment. If the person is experiencing breathing difficulties, they should access medical treatment. But keep doing this as you wait for the medical treatment, or if the treatment is delayed or not available, which is what's happening right now. You don't want to just sit around and do nothing. That's the point. If you take this as a package deal, I am so confident you will see amazing recovery. If you start this as soon as you have the initial symptoms of the virus, there is a good chance you will recover with very mild symptoms. And if the virus has progressed, do these simple things along with following the recommendations of your doctor. You will be amazed. I have seen this work over and over again. I wish you all the very best. We are all praying for you. You are not alone in this. This will pass. I am here to help in any way I can. Don't shy away from asking me any questions. Leave your questions in the comment section below. I will be more than happy if I can be of any help. Don't panic. Don't lose hope. Be proactive. Implement these advices and then share your good news with me. Take very good care of yourself and your loved ones. I will see you shortly. Goodbye.